Hi, everybody. This is Dr. Grzina Fajunen, and I'm here with amazing guest. You would enjoy her a lot. Her name is Amelia South, and basically, believing or not, she's an expert of healing most of the common chronic illnesses through taking care of your gut. So, Amalia, I'm really curious how you can do that. You go to the doctor and you say that your stomach is hurting or whatever, and they are not talking about what I learned from you. So tell me, what is the difference and how you can help people? Because those illnesses which you are talking about are very common. So we would like to know, and also how that influence absorption rate, with anything that they eat, because they spend a lot of money on food to try to get a lot of my audience, they're absolutely taking care of their health and try to eat correctly. So how that influence when they have a gut problem and what to do with gases inside the stomach. So here you are.
All right. Well, there's a lot that goes into it. I'm going to try to keep it as simple as possible. So, you've heard the phrase "you are what you eat." A lot of
Yes,
people have heard "you are
absolutely.
what you eat." So,
Yes.
in reality, you are what you absorb. If your body's not actually absorbing the vitamins and minerals and nutrition from the food that you're eating, then it doesn't matter how healthy you're eating, it's not actually getting into your body, or at least not enough of it is getting into your body. So um, a lot, maybe not all, but a very large portion of people's systemic problems or chronic problems are related to a vitamin deficiency, a vitamin or a mineral deficiency, or a gut imbalance. There's something called gut dysbiosis, and it sounds weird, kind of scientific, but it's basically when all you have bacteria in your gut, right? So microscopic bacteria in your gut, everybody has them. When
Yes.
your gut is in dysbiosis, the bad bacteria outnumber the good bacteria, and that can cause a lot of problems. There's also, if you've never heard of leaky gut, I'd be happy to explain that to you in a way people can understand pretty well. But leaky gut is honestly, it's a cause of so many chronic illnesses. I mean, eczema, rosacea, psoriasis, although that could be SIBO too, small intestinal bacterial overgrowth, candida, chronic candida, uh, type 2 diabetes, it does affect that. So does your diet. Fibromyalgia, pretty much all autoimmune disorders are related to your gut. And I can do my whole spiel explaining that if you'd like me to explain leaky gut. But basically there is a connection between your gut and your skin, and there is a connection between your gut and your brain. So your digestive tract is basically like your second brain. You
So,
think
so actually, if people are depressed, that is also maybe the cause also of the.
it is related to your gut in a lot of ways. Um, Maybe not 100%, but there are so many things you can do when you heal your gut. Between healing your gut and just getting outside in sunlight and nature once in a while, that can lower most people's depression by a lot. But even the clinical depression is related to a dysbiosis in your gut bacteria.
Mhm.
So healing the gut is basically, in my opinion, the first most important step towards healing the rest of everything in your body. And again, like I said, it might not fix 100% of everybody's problems, but it should at least reduce your problems and your symptoms that you're having. It and at the very least going to make you feel 1,000 times better and look 1,000 times better.
Yeah, actually, people are taking care more about their houses, cleaning their house. But as far as I saw, really, Amalia got what was covered with a black substance
Oh, geez.
to call it, the walls.
Yeah.
They covered, and then they will be small, those holes which you are talking about, the leaky
Mhm.
gut.
Yeah.
And I was wondering, even if you go to a doctor, and let's say because of the heart disease, and you get a prescription drug, but even then, that drug go to the circulation, blood
Mm-hmm.
circulation, and then it has to go to your intestines somehow.
Yep.
I mean, it has to get to intestines to get to the blood circulations. So
Mm-hmm.
when I saw those pictures with those walls covered with the black substance,
Yeah. Yeah.
I wonder.
Yeah. Well, that's the medications. That's why they say medications can have side effects. And it's up to the individual person to decide whether the benefits of the medication outweigh the number of side effects that you're getting for it. Like I'm not about to tell anybody don't take your heart medication. I don't want to be hurting anybody like
No,
that.
no, of course
But
not.
but there are times where a doctor will prescribe a medication that you don't necessarily need, and that is going to honestly do more harm than good with the side effects that you're dealing with. It ends up happening that somebody goes to the doctor, they get a prescription for something, and then they have so many side effects. They go back to that doctor and they say, listen, yeah, this one pill is doing this thing for me, but I've also got this, and this going on now, side effects. So the doctor says, okay, well, here's this pill and this pill to deal with those side effects. Before you know it, you're on 16 or 17 different medications just to deal with that one problem of the medication that you actually needed, which is why a lot of people end up just overwhelmed. Their system is overwhelmed with all of these side effects. That can also cause, leaky gut. Overuse of medications, overuse of antibiotics can cause holes in the gut lining like that. And it's a recipe for disaster, for long-term disaster.
Yeah, that's exactly right. But I was talking even more, not for medication or against, but for the absorptions of that medication.
Oh yeah, absolutely.
You
You're
know?
right. Yeah, you're right. Because it's not going to necessarily absorb if it's leaking out into your bloodstream or into your body cavity, which is what happens with leaky gut. It's not going to get to where it needs to go. It's or not enough of that medication is going to be able to go where it needs to go, or possibly you end up with liver issues because of the digestive issues, and then the liver isn't detoxifying the stuff that goes into the liver's part of the digestive tract as well. So it's an endless cycle, and it's hard to it's hard to
So
touch all of
anyhow,
it at once.
everybody is different.
Yep.
So how you can help people? Because
Um,
those people are suffering. So, and they really need guidance because at this moment, when you go to supplements and they are trying to listen to this, listen to that, and get
mhm.
this supplement and that supplement, it's like going to a jungle
It
and
is. It
you
is.
don't know what to do.
So, me personally, I do consultations for people. I do also have a gut healing protocol that I created because after I healed myself and I healed a lot of my one-on-one clients, I offer my gut healing protocol, which is basically like a kind of universal list of things you can do to heal your gut, probiotics and other things like that. It's a series of steps. And I tell people, I tell my clients, look, if it was just a matter of me saying, hey, go take this pill and all your problems will be gone, I would try to sell you the pill because why not? I'm not going to do that because it's so much more than that. It's healing your bodies. It's a system. It's a lifestyle change. So I do have that, or I talk with people and I help people with individual on an individual basis. In the end, you have to decide, whoever you are, you have to decide if somebody like me or whoever you want to listen to is calling out to you, basically. Trust your intuition. If your intuition says, you know what, I like this person, I believe them, I trust them, then go with that person. Go with that whatever you think that they are telling you is going to help you the best.
Well, you told me that you helped yourself. So what was happening with you?
I had chronic candida for over 17 years.
Wow.
Yeah, yeah. So that was nonstop. And if nobody's familiar, candida is an overgrowth of yeast bacteria in your body. It can cause yeast infections. It can cause ringworm, which is not, it's a fungal infection. Yeast can also cause tinea versicolor, a lot of other fungal issues. On top of that, I got diagnosed with rosacea about 4 years ago. So I had big red splotches, patches all over my face. And I figured out that I needed to heal my gut because all this stuff, no matter what the doctor gave me topically, none of it was healing the problem. The problem was in my digestive tract. So that's where I started. I spent
So
a
how
year.
did it develop? So I know that nowadays you are growing your own herbs and you know a lot of about that and you can advise people based on different herbs for a different person. Is that correct? Tell a
Yeah.
little bit more about that.
Well, I am an herbalist. I've been practicing herbalism. I've been practicing herbalism for like 13, 14 years, but I really like heavily studying it intently since about 2018. So I've been studying herbs and herbalism, and any good herbalist is constantly learning new things. So the thing is, a good herbalist that wants to help heal people holistically is still going to start with food and your digestive tract, because the food that you put in your body, food is medicine. The food is the one thing that you need. Or
So
I tell people, um,
Socrates.
think of your body like a cake. So your digestive tract is like the cake part, the cake that you would bake. And herbs and supplements and things are like the icing on the cake. So you can't have the herbs aren't going to really do any good on top of your cake without a good, strong cake foundation, which is your digestive tract. So you've got to pay attention to the foods and other substances you're putting into your body. So
Absolutely, absolutely. So, because people know me that I am taking care of the connective tissue, but even if you are having everything you can get for the connective tissue, still, if you have problems with your gut, you have to solve this problem. So. With some people, I can help them when they don't have a big problems. But if they have big chronic problems, it would be great to cooperate with somebody like Amalia that knows, specializes just in that area, because everybody, according to my opinions, should know a lot but specialize in one small area, because then we can really help people all together. We know then what is the most important for this person, what is the most important for this person, and then we can help them to rebuild. Now, give me a few examples of working with your clients and having some results, because we are all here for results. We are not here to sell you this or sell you that or whatever. We are here to help you. So give me a few examples like that you work with somebody and
the most recent examples, just in the last month or so, once I developed my gut healing protocol, that was just an easy, applicable to everybody kind of thing. It cost less than a consultation, so more people were interested in buying that, and a few people bought that. I want to say maybe 4 months ago, that they had seen me on I do TikTok, so they had seen me on TikTok live and talking, and they were like, this sounds really good. And I said to them, listen, this is a lifestyle change. You're going to have to put the work in. But if you want to heal yourself badly enough, this is absolutely going to work for you. This is going to help you. And some people buy it and they get turned off because they're like, well, I really wanted an easy button. And I'm like, there is no easy button. But the people that get it and actually follow my instructions, and they can come back to me for help. They get support from me directly. But there's several people that have followed it in the last month came to me and told me, hey, I just wanted to let you know that I'm no longer type 2 diabetic. Just two people in the last 2 weeks told me that they reversed their type 2 diabetes thanks to following my protocol. And that one woman said, I've been trying to heal myself for 10 years. I've known you for 6 months and I'm better. And I said, all right, good. That's fantastic.
Isn't this amazing? It is so satisfactory for us, isn't it?
It is. I love being able to help people and make a difference in their lives, because this is what I do. What I try to get people to do is make long-lasting changes. Like
Mhm.
you're going to be a different person by the time you're done with me. So that's a good
Well, and
thing in a
actually,
good way.
you always need to stay in touch with you, right? So you have probably a group program, and they can get in touch with you, because this is not something that it is changing your lifestyle. It is changing the way who you are. That's for sure. But it's what. So give me one advice. Let's say I come to you and I say, Amalia, I have a problem with gas in my stomach.
Okay.
What
If
what would you tell me to do?
Well, if I didn't know you, if I was talking with you over the phone or something, and I didn't see you, first I would ask your age, because people over a certain age, usually like 40 and up, your body actually doesn't produce as many digestive enzymes. The older you get, the fewer digestive enzymes your gut produces to help digest the food that's coming in. So it actually it gets more and more difficult as you age to digest all the food, especially if it's something that you haven't had before or haven't had in a while. Like if you're used to eating the same sorts of things all the time, and then you go and have um I don't know, a smoothie from somewhere that you've never had before, your gut could just blow up because you don't have those digestive enzymes. So I usually recommend there is a company that I like to work with that sells digestive enzymes and probiotics. I mean, a good probiotic is essential, but sometimes the probiotic isn't enough, and adding the extra digestive enzymes, especially if you can remember to like take it before you eat that strange thing that you're not used to eating, that's going to help reduce the gas, because the gas is because all of the bacteria in your gut just don't know what to do with that food that they're not used to seeing in there anymore. They're
No, this is
confused.
fantastic, Amalia. I've never heard anybody explain it this way. It is you see, guys, she is really full of knowledge, and she can help you. So, Amalia, we are coming to the end of that very, very short, I'm pretty short introduction. I wanted to introduce you to my audience, and I just want you to tell everybody, if you have problems and you would like to get in touch with Amalia, what you can do.
Oh, yeah, yeah. I have a website where I teach all my classes, and you can sign up for a consultation if you want. That's
I
herbalremedies.com.
will put that link under this video. You will have all those links what Amalia is talking about under
Yeah,
the video. So just tell a little bit what they can expect from each link, and then
sure. Yeah, because I'll give you the link to my report. I have a report that I wrote that explains to you the basically like the kind of secrets of the industrial food system. It teaches you what to look for at the grocery store so you don't get caught off guard, so um, the right things to eat versus to buy and to not eat, to stay away from for your own
and watch the
personal health.
labels, right?
Oh,
Watch the
yes.
labels, read the
Yes.
labels, and be able to
Yes.
understand those labels.
That's what I aim to help people with. Yeah, because it's a lot of it is very confusing if you're not used to it. So
Exactly.
that's the other thing. So yeah, those are
Yes,
those are the main ways to get a hold of me.
and also you are going. So this is going to be like the information that it will be one of those links, right?
Yeah, yeah, you'll be able to get
Okay.
yeah, it's a free download that you can get.
Free download. Okay,
Hmm.
fantastic. Thank you so much. So, guys, I'm going to put all this information under this video, and please get in touch if you know anybody who has those problems. They don't need to suffer. And this is the very first step. So they would be able to heal their gut, and then we are going to rebuild the body, and we are going to remove inflammation. And this is all lifestyle changes, and also have this certain exercises as usual, so that, and the mindset. If you don't have the right mindset, if you believe you cannot and you believe you can, in both cases you are right. Right,
Yeah.
Amalia?
Yep, that's true. That's true. It's
That's
all
right.
what here.
It's all right here, and we work on the entire system. So thank you so much, and put comments under this video if you have any questions, Amalia, or If you want to get her help, get her help. Do not suffer. Remember, suffering is optional. You don't need to do that. Okay. Thank you, Amalia, very, very, very much.
Thank you. Yeah.
Okay. And talk to you next time. You know,
Okay.
if you'd like to join us again, then we will have you with a pleasure to have you again.
Awesome. Absolutely.
Okay. Thank you. Bye.
Thank you. Bye.